The lower limb and its girdle are studied in 4 parts: the foot, the leg, the thigh, and the hip. Let's start first with the foot. The foot is consisted of 26 bones. We have 14 phalanges, which is the bones of the toes, 5 metatarsals, the bones of the instep, and 7 tarsals, which are the bones of the ankle. So the foot is divided into 4-foot, which includes the metatarsals and the toes, the midfoot, which includes the 3 cuneiforms, the navicular, and the cuboid, and the hindfoot that includes the talus and the calcaneus. So when the bones of the foot are shaped and joined together, this forms a series of longitudinal arc and the transverse arcs. So both of these has functions. The longitudinal arc serves as the shock absorber, as this distributes the body weight in all directions, which permits smooth walking, while the transverse arc which runs from side to side assists in supporting the longitudinal arc. So the superior aspect of the foot is termed as the dorsum or the dorsal surface, and the inferior or the posterior aspect is termed as the plantar surface. Now let's take a closer look with the parts of the foot, starting with the phalanges. As I have mentioned, we have 14 phalanges, 2 in the greater toe, which are termed as the distal and the proximal phalanges, and 3 in each of the other toes, termed as the distal, the middle, and the proximal phalanx. Each phalanx is composed of a body and 2 articular ends: the proximal base and the distal head. Next up is the bones of the instep, the metatarsals. These are numbered 1 to 5, starting from the medial or great toe side of the foot. It also consists of a body and 2 articular ends. The proximal expanded end is called the base, and the distal or the small rounded end is termed as the head. The first metatarsal is the shortest and thickest, while the second is the longest. A prominent tuberosity can be noticed on the lateral side of the 5th metatarsal base. This tuberosity is a common site of fractures. Now let's proceed with the tarsals. The proximal foot contains 7 tarsals, namely calcaneus, talus, navicular, cuboid, the middle cuneiform, intermediate cuneiform, and the lateral cuneiform. So these can be remembered using the following mnemonic: chubby, twisted, never could, cha, cha, cha. So calcaneus is the largest and strongest tarsal bone. So it projects posteriorly and medially at the distal part of the foot. Its long axis is directed inferiorly, and it forms an angle of approximately 30 degrees. The posterior and the inferior portions of the calcaneus contains the posterior tuberosity for the attachment of the Achilles tendon. On the superior aspect, there are 3 articular facets that joins the talus. They are called the anterior facet, the middle, and the posterior facets. Between the middle and the posterior facets is a groove. It is called as the calcaneal sulcus, which responds to a similar groove on the inferior side of the talus. When these two sulcus are collectively formed, this comprises the sinus tarsi. So let's take a look with the sinus tarsi. Okay. Here is the sinus tarsi. As you can see, it is the compromission of the sulcus from the inferior side of the talus and from the superior surface of the calcaneus. So now let's take a look again with the calcaneus. On the medial aspect of the calcaneus, it extends outward as a shelf-like overhang, and it is termed as the sustentaculum tali. Here's the sustentaculum tali. And on the lateral surface of our calcaneus, it contains the trochlea. Alright, now that we're done with the calcaneus, let us now proceed with the talus. Okay, so it is irregular in form and it occupies the most superior portion of the foot. It is considered as the second largest of the tarsal bone. The talus articulates with 4 bones. So let's see. Okay, so here is our talus and it says that it articulates with 4 bones. These are the tibia, the fibula, the calcaneus, and the navicular bone. Alright. So the superior surface, which is called the trochlear surface, it articulates with the tibia. The head of the talus is directed anteriorly and has an articular surfaces that joins the navicular and the calcaneus. On the inferior surface of the talus, there is a groove, the sulcus tali, that forms the roof of the sinus tarsi. As you can see, here is the groove. Posterior to sinus tali is the posterior articular surface of the talus for the articulation with the calcaneus. While on the lateral surface of the foot, we can see the cuboid. Okay, here is our cuboid. It lies between the calcaneus and the 4th and 5th metatarsal. While on the medial side of the foot, we can see the navicular bone. So the navicular is on the medial side of the foot in between the talus and the cuneiforms, while the cuneiform lies at the central and medial aspect of the foot. It is between the navicular and the 1st, 2nd, and 3rd metatarsal. The medial cuneiform is the largest of the 3 cuneiform bones, and the intermediate is the smallest. Now, beneath the head of the 1st metatarsal are 2 sesamoid bones. Okay, so these are small bones and they are detached from the foot. These are embedded within two tendons. These are seen on most adult foot radiographs and are common site of fractures. That's why it must be demonstrated radiographically.